The birds and the bees, 5 words that always get a response. Sex education is a topic parents don't look forward to discussing with their children, or they avoid the topic altogether because if they don't talk about it, then their child won't do it. According to the Youth Behavior Surveillance Survey done annually by the CDC, in 2017, 39.5 high school age students had sex at least one time, 9.7 had 4 or more partners, 53.8 used a condom, and 20.7% used birth control pills. If they're not receiving education at home, it's something that needs to be covered in school. With all the sex in the media, on TV and movies, unlimited access online, sketchy information from their peers, wouldn't it be best that it be taught in the school by a trained professional? I'm a mom of 2 daughters. I have a degree in public health, and I think it's extremely important that we reiterate the importance of sex education in schools. Today we're going to discuss the importance of sex education, comprehensive sex education, and the topics covered, and the effectiveness in schools. Planned Parenthood is the #1 provider of sex education in America. It reaches 1.5 million people per year. They focus on providing information, skills, motivation to make healthy decisions about sex and sexuality. They also offer a variety of materials for schools, parents, and children to discuss these topics. The statistics don't lie. According to the Department of Health and Human Services, 1 in 4 adolescent is between the ages of 15 and 24 will have an STD. According to the CDC, in 2016, 63.1% of new chlamydia cases that came in were in people from ages 15 to 24. According to the CDC in 2016, between 2009 and 2013, the new cases of syphilis were decreasing in the ages of 15 to 19, but in 2016 it increased again by 13%. Also, according to the CDC, 21% of new HIV cases in 2017 were in students aged 15 to 19. This is a graph of the trends of unplanned unintended teen pregnancies, which is declining. Let's see. The Department of Health and Human Services reported in 2019 that only 5.3% of births were unplanned and unintended between the ages of 15 and 19, and that is the lowest in U.S. history. And that is linked to education on abstinence, use of birth control, and condoms. Now we are going to move on to cover topics and information about comprehensive sexual education. So, guidelines set for comprehensive sexual education were established by the Sexuality Information and Education Council of the United States in 2004. They came up with the guidelines for comprehensive school-based sex ed programs, which is to be available at every grade. Make sure that it's age appropriate, developmentally appropriate, and that it respects cultural backgrounds, diversity, values, and beliefs. The Future of Sex Education, which is a collaboration with the SIECUS, Answer and Advocates for Youth, established the National Sexuality Education Standards in 2012. Within those standards that were set by the group FOSE, it provides teachers with prep standards for teaching sexual education, which is generally taught in health classes or physical education. It also allows universities and colleges to require students going into those fields to complete courses to be able to teach sex education. So, some topics that are focused, this particular list that's over here is from the Planned Parenthood website, which was updated just last month. These are the 6 topics that they focus on. There are other groups that have more focused ones in, but I thought that these were good ones to start. So the first one is human development, which is about puberty, reproduction, gender identity, sexual orientation. The second one is relationships, building healthy relationships with family, friends, dating, and romantic relationships. Personal skills, being able to communicate effectively, decision making, sexual behavior, abstinence, and then sexuality through life. Sexual health, so STDs, contraception, and pregnancy. And then society and culture, so the gender roles, diversity, sexuality, and media. So now that we've covered the importance of it and the focus of sexual education, we can talk about the effectiveness of it. So Guttmacher Institute, which is a research organization providing information on contraception and abstinence, found that these were the most effective, what they considered effective from a survey that they did in 2017. So sex education in schools helps to delay sex in young people, build healthy relationships, avoid STDs and unintended pregnancies, reduce frequency of sex and the number of sexual partners, increase condom and contraceptive use, and reduce sexual risk-taking. There are several collaborative organizations that think that sexual education is essential. These were found on the Planned Parenthood website that was updated last month. The American Medical Association, American Academy of Pediatrics, and Society of Adolescents for Health and Medicine. And then 24 states and Washington, D.C. mandate sex ed. 34 states mandate HIV education. And all schools have received the guidelines for having sexual education, but they can decide what they want to do. So 1 in 4 sexually active teens will have an STD, is the statistic. Not every parent is willing to have the talk with their kids about the birds and the bees, but someone has to. The media, TV, movies, internet, and peers are not reliable sources. If someone doesn't have the control with their children, somebody needs to. We are obligated to provide sex education from trained professionals. Over the last decade, the number of unplanned, unintended adolescent pregnancies has gone to an all-time low. It's time for us to take that momentum and move forward with sex education in school.